December 1st is World AIDS Day, so for today's video, I want to break down one of the most recent approvals in HIV prevention, known as Yeztugo, which uses the active ingredient Lenacapavir that made my top drugs list of 2024 for its use in Sunlenca, which is for HIV management. However, earlier this year in 2025, Lenacapavir gained a new indication as a form of PrEP, or pre-exposure prophylaxis. However, Sunlenca can be used as both an oral medication or an injectable medication, as well as in combination with other retrovirals. But Yeztugo is given as just an injectable medication that we'll talk about at the end of this video. And I go into much more details about how Lenacapavir works in a previous video that I'll link to this video's description below. But in brief, HIV viruses are composed of capsids, and these capsids form a capsid core that help to protect the proteins associated with that virus. By protecting those proteins, it helps it infect immune cells, releasing its own DNA that can then be inserted into our immune cells' DNA, creating an HIV factory. However, when Yeztugo, or Lenacapavir, is administered, it's able to inhibit that capsid core formation, so not allowing the different components of the capsid to come together to create that protective core, and it also prevents that DNA that's released from an HIV virus from entering our own immune cell's nucleus. Therefore, overall, this drug is a viral delivery disruptor. But when one is prescribed Yeztugo, after initial tolerability dosing with injectables as well as oral pills, then the dosing regimen is just 2 times per year, utilizing that technology of long-acting injectables that we've also talked about on the channel. So if you have another medication that you want to learn more about, make sure to drop a comment in this video's description below and stay connected to my channel and with Dane Garvin.